I'm sorry. This is what happens. That's why I have to come on Mondays at 4, because I have my alarm set for Mondays at 4, and it reminds me 30 minutes before, like prep for the call. Hey Vanessa, can you check that my sound is good? Can you guys like give me a thumbs up? I'm on. You can hear me? Well, you know what? At least I'm still here. I'm going to answer your questions. Thank you for giving me a thumbs up. I'm going to answer your questions. I got a bunch of them. And I can tell you one of the reasons why I'm late today is because we got wrapped up in a case review, talking things through, looking through the resources, and just nailing down what we're supposed to do for a particular case, right? So anyway, let's get started. Let's get started with answering some of your questions, okay? So if you are gonna catch, if you are not here catching this live, then I hope you are willing to watch the replay that I'm going to post onto YouTube at another, after this call later on this week. Okay, so getting started. One of the questions is like, how do you get started in hand therapy? Actually, on Hand Therapy Secrets YouTube channel, I have a few series of videos that go over like, how do you get started in hand therapy? What do you need to do? It comes down to like getting your resume together. Really, honestly, I can go into depth with this, but getting your resume looking good so somebody will actually call you back. And then getting a certain amount of experience, whether it be volunteering, taking classes. It's huge. It's hard to, you know, go somewhere and be like, can I have that job, please? Even though I know nothing and I haven't done anything at all to learn about what I'm supposed to do. So it can be difficult, but it's very, very possible to get started in hand therapy. Check out YouTube, our YouTube channel, Hand Therapy Secrets. There's a couple of videos on there. And if you want something more in depth, you can just make comments to those, and you know, I can go back through and answer some of them for you. But getting started is hard. I'm not going to lie, especially in very saturated areas. Like, so I'm here in Miami, Florida, and Miami is saturated with occupational therapists. And I'm not gonna lie, I think a lot of therapists that come and try to apply for jobs is really, really difficult. One of the key things is if you're gonna get some experience, get it in adults. I find that it is very difficult to transition fully from peds into like hands. Not saying that it can't happen, I'm just saying that I think it's quite difficult, but if you're doing some kind of adult and then transition to hands, a little bit easier. Okay, wound care classes. I actually don't know of any great wound care classes. So if someone here is watching, if you guys know of a great wound care class, let me know. Everyone that I know that I'm currently, you know, working on putting together a few things. We do a lot of wound care here, and if you're in my community, I've shared some wound care videos. So if you're new to joining me and you want the video, then you just have to email me and tell me, hey, where's that video? And I'll get it to you as soon as I can. All right. All right, so another couple of questions when it comes to just hand therapy, supplies for splinting. All right, when it comes to supplies for splinting, you need stockinette, you need splint material, whichever one that you like best. Normally what I recommend is if you work in a group, think about what kind of materials would work for everyone's level. That might be good too. You can certainly try 2 different types of materials. That way you have some for maybe larger splints, some for smaller splints. And then you need adhesive hook, right? So the hook is the rough edge, right? So that needs to be adhesive, that needs to stick to the splint. And then you need some kind of strapping, or you can use loop, and that's a soft fuzzy one. So I would say those are your most basic splint. materials that you would need, and a hot pan. You know, like it doesn't need to be some fancy splint pan. It could be one of those electronic little skillets that you can fill with water, has a lid. Those are very portable and really nice. I think on my YouTube channel I have a video about what that splint pan looks like, and I also it's part of what we give in our Orthosis 101 course, and I think there's a video on YouTube, and it shows that splint pan, and it goes over, shows the different types of materials that you get with Orthosis 101. So maybe if you're just looking to get some supplies for your clinic, you can look there, because I kind of describe all the materials that I send out in Orthosis 101. Those are some of the most basic materials that you can use. All right, so I have a couple of technical questions. How do you manage CMC arthritis pain? So that came with trigger finger one too. So when it comes to CMC pain, a lot of times I will use, if they have a lot of pain, I'll create a custom fitted orthosis for them. I usually do a short, small opponent's orthosis to help them to control the certain amount of motion, or control their pain at least. And then once you can subside that, it'll help to also do some manual treatments, because a lot of times the arthritis isn't, how do you say, it's not so much the arthritis is causing the pain, it's all the tissues around it as well. So if you have arthritis pain, maybe your joint's not moving as well anymore, so then the muscles around it are going to be impaired, along with the skin and the nerves that run through it. So always check range of motion. Thumb range of motion, the thumb likes to fall inside the palm, so you got to work the adductor here. It sits right over your wrist, so you've got to take a look at wrist range of motion, and you can look at function, like how are they using their hand, how can you modify it a little bit. But most of the time, people with it, they're already doing a certain modification. So then your questions are a little bit more in depth, like how are you modifying? What else can you do to tweak it just a little bit to help them even better? Trigger finger, how do you manage trigger finger? Well, you've got to stop them from triggering. I was sitting next to a friend of mine one day, and he was triggering, and one of the things that they like to do is they'll play with their trigger. Can't help themselves, I'm telling you. You could tell them don't do it, and they're still going to do it. So you've got to find out where they're triggering, how they're triggering, and then stop them from triggering. So I like to make sure that they have full motion, and it's not just going down into a fist. It's going to full extension, going to hook fisting, and finding out exactly where they're tight. So you've got to know your anatomy when it comes to those kind of things. Somebody asked me for structures of the fingers. So that's a really complex question, but one of the things that you can do to study is you want to learn how the bones are. You know, what are the bones, how do they move, what type of joint it is, and then you learn about the muscles that are in the hand. The intrinsic muscles of the hand are huge. They play a really huge, very important role in terms of OA pain, like CMC thumb pain, right? Trigger finger. Those you have to know. I did a short session on it in my kickoff call for the CHC fellowship program. I think I put that on YouTube. It is an hour and a half, hour and 15-minute long video, but just go like probably like 40 minutes into it, and I start talking about the intrinsic muscle, so you can weed through that a little bit and find that one clip. But yeah, know your bones, how the joints move, and then dive into the muscles of it. So you've got your intrinsic muscles. Look up your intrinsic muscles, where they start, where they end, and what is their role in terms of moving your fingers, right? And then after that, you can dig into more of like the ligaments and the tendons and how they move. But once you know anatomy, then you can also then apply to like, what do you do for some of the CMC OA pain? What do you do for a trigger finger? All right, so, tennis elbow. Oh my God, That's what I was like balled up before, and that's why I was late. I was talking about tennis elbow. We have a complicated tennis elbow, and I was looking, we're going through conservative treatment and then surgical treatment, but tennis elbow, if you have someone who's chronic, the most important thing to remember is that it's chronic. And I would say look at the hands and wrists. You know, are they moving? Are they using it in a certain way that might be causing them to have more pain? Look at the shoulder. The shoulder plays a huge role. If the shoulder's weak, or really the scapular stability of the shoulder, if that's weak, then it puts more force onto the elbow and the muscles of the elbow and wrist, making that person work a little bit harder in those areas, and that's why their tennis elbow is chronic. Someone who doesn't have strength could have tennis elbow, and someone who has too much motion can have tennis elbow as well. The most important thing to remember is, because it's chronic, one of the key questions that we ask our clients is like, what are they looking for? A lot of times people just want to tell you, oh, they're looking for an exercise. It's not that simple, because believe it or not, a lot of people aren't looking just for that home exercise. It's not like some magical exercise it's going to stop them from having tennis elbow. Key thing with tennis elbow, just like with any other chronic thing, is if you have a really good follow-up system to follow up with your patients, then you're going to be more successful in helping them get rid of this kind of problem. Okay, so last question. So someone gets 100% active range of motion in therapy, and then they go home, they go to sleep, and they wake up and they've lost, 40% of it. So now they're at 60% again. And I think that it matters the severity of the injury, and it also matters what they're doing and how they're doing at home. Do you know that majority of the time we take for granted as therapists how much we know and how much we love therapy and how much we want everyone to exercise, but people might not be doing their exercises as well at home as they do with you, right? That's your whole purpose in life, is that when they come in, you can help them. So I wouldn't be so disappointed that they cannot attain exactly what you can attain for them in therapy. But it's just about, again, following up with them to make sure that they keep consistent. People have a very, very hard time doing exactly what you do. That's why they continue to come in to see you. It's because they have a really, really hard time doing exactly what you do. And in the hour, you're doing all this stuff, When they go home, they might not be doing so much of it. They might not be as warmed up. They might not be as, doing it as often. And let me tell you, when you go to sleep, you don't move. You don't move for hours. So guess what happens? You stiffen up again. That is the natural process of stiffness. So let's say, I get this all the time. I have somebody who has a distal radius fracture. They come in, you get them moving, their fingers feel really loose, but that's because you've been working with them for an hour. And then when they go home, God knows what they're doing. They're probably doing like a bunch of this. They get tight and they get painful, and it's hard to stretch yourself as well, as someone else can. It's hard to, consistently stretch yourself, and so by the time they come back to you, they're like, oh my God, I'm so stiff. That is the natural process of an injury. So you have to learn the healing process, and it takes a while. It's not like, oh, you have surgery, this person did so well, and so everyone's gonna do so well. It's not the case for everybody. And so, you wanna be patient, you wanna teach them to be patient, and then you also wanna outline success for them. What does success look like? So if they're stiff in the morning, can they do certain things that will help them unstiffen, and then within a few hours get that motion again? Like, every injury is so different, and that's why patients are coming to you as a therapist, as occupational therapist, and hand specialists, they're coming to you for that guidance. And so it's very important for us as a specialist to really give it to them and to be more patient than they are. All right, so those were my questions. I didn't have a chance, and normally one of the things I do is I'll go and look right before I come on to see what new questions someone had asked, but those are the questions the last time I checked earlier this afternoon. All right, so thank you all for joining. Let me know if next time I'm gonna be on time at 4 on a Monday. So join me next time, Monday, live here on Instagram at 4 p.m. Eastern time. All right, thank you so much, and I will see you next time. Oh, and if you don't catch this, or if you want to listen to it again, you'll find it on YouTube at Hand Therapy Secrets. All right, bye guys. I will talk to you later.